Hello, and thank you for listening to our presentation today. We are Group 11, and our program is called Hookah Free, Live Free, a health education intervention to increase awareness and health risks of hookah tobacco smoking and reduce usage among young adult college males aged 18 to 24.
So Hookah Free Live Free has 3 goals in mind. Our first goal is to reduce hookah smoking among male college-age fraternity members ages 18 to 24. Our second goal is to increase awareness and knowledge of the dangers of hookah smoking by dispelling myths about hookah smoking. For example, one myth about hookah is that it's not as dangerous as cigarettes, when in fact, this exposure to nicotine and carcinogens is just the same. This leads us to our last goal. As a result of our education intervention, we want to empower college males ages 18 to 24 to make informed decisions based on the knowledge gained from this health education intervention.
The purpose of our program, Hookah Free Live Free, is to increase awareness on the health risks of hookah tobacco smoking among college fraternity males ages 18 to 24, ultimately educating these participants and correcting any wrong beliefs regarding hookah. Our program includes 3 main objectives. First, after the end of the intervention, participants will be able to identify 2 key health risks attributable to tobacco and hookah tobacco smoking usage. Second, after the 3-month follow-up, 80% of the current smoker cohort participants will have reduced or ceased tobacco usage. And finally, third, after the 3-month follow-up, all non-smoker participants will have maintained a tobacco-free status.
The theory of planned behavior can be used as an effective tool in determining the underlying reasons for hookah tobacco smoking among college fraternity males ages 18 to 24. It enters on the concept that individuals' intention to act on a given behavior is contingent upon their attitudes towards the behavior as well as their subjective norms associated with the behavior. The first factor, attitude towards the behavior, is attributed to placing positive or negative values of performance on a behavior. These attitudes originate from behavioral beliefs. In return, behavioral beliefs associate the behavior with numerous outcomes and characteristics. For instance, an 18-year-old college male student who has strong beliefs that quitting HTS will reduce his chances for future respiratory problems will have a positive attitude towards non-smoking activities. The second factor, subjective norms, is known as the perceived social pressure that arises from individuals, friends, parents, relatives, peers, role models, and even experts. An example would be an affiliated male student who values his pledge brothers' opinions and living in a smoke-free life and joins them in taking part in the Hookah Free, Live Free intervention program.
In order to measure the effectiveness of the Hookah Free Live Free intervention, there will be a baseline and 3-month follow-up questionnaire testing the participants on the main aspects of the online presentations. These aspects include awareness, knowledge, and attitude towards hookah tobacco smoking before the intervention. This will not only allow the research team to see whether the participants did in fact learn from the online presentations, but also how well the information provided was retained. The effectiveness of the intervention could potentially lead to a more widespread implementation.
Now, to go over the research design of our intervention, we used a non-experimental design using time series. And we have 3 cohorts of participants. We have current smokers of any kind, former smokers, and non-smokers, so that we can compare the differences between the 3 different cohorts. We have a pretest to assess smoking rates, beliefs about tobacco smoking, and just to get an overall baseline knowledge of the 3 different cohorts. Then we have a post-test immediately following the 6-week intervention, and then a 3-month follow-up. Now our primary measure is going to be the smoking habits among the participants, so including the current smokers, former smokers, and non-smokers, with a secondary measure of peer education, because we want the participants to not only use the information gained through the program for themselves, but also to share the knowledge with family and friends. Now to go over our evaluation design, we have observation 1, followed by the 6-week intervention, then observation 2 immediately following the intervention, and then observation 3 at the 3 months post-intervention. Now to go over the advantages and limitations of our evaluation plan, so since we are using surveys, this is a very cost-effective strategy and very sustainable for our target population. However, since the information will be self-report from the participants, there's a chance that participants may fabricate if they're a current smoker or not. Also, there would be no biological testing for nicotine levels in the body, so we rely on self-report information.
We're Group 11.
And thank you for listening to our presentation.